Can you all see me? If you can see me and hear me, can I see a quick thumbs up, please? So, I don't know, there is a lag. Can you all see me? Yep. So welcome everybody. Welcome to this session, which is on importance of video-based MCQs and how PrepLadder can help, right? And this is Dr. Shanmugapriya, your PrepLadder faculty for Biochemistry. And before I start, yes, I see some of you, particularly Movie Masala South. He or she has got a doubt, still not able to know what to notice and how to confirm and exclude some diagnosis, lack of clinical eye without any clinical experience, right? So this is something just quite challenging when it comes to video-based MCQ. Please tell me. Yeah. So first, let me address the first question. What is the importance of video-based MCQ? Right? So do you think it's appropriate to ask video-based MCQ in medical entrance examinations and medical qualifying examinations? And the answer to that question, you might not like my answer, but the hard truth is yes, it is appropriate. And if you're asking me why, the main reason behind this is when you start practicing, right? When you start practicing, nobody is going to come and tell you that he or she has got global confusion. Am I right? Nobody is going to come and tell you he or she has got tendon xanthomas. So what happens here is, if I am an examiner, if I have to write a stem of the question, and if I have to describe a patient who is finding it difficult to find out what is happening around him or her, the person finds total disorientation towards time, place, and even person, and the person is not able to recollect even the recent memory. I'm so bored, right? I'm so tired of writing down all these statements. So instead, what I would do is I would use a shortcut. I would call it as global confusion. And the moment the textbook or an MCQ describes this as global confusion, after that, every student starts memorizing it as global confusion, ophthalmoplegia, ataxia. We set up a mnemonic to it. GOVA stands for Wernicke's encephalopathy. Or global confusion, and tremor would refer to delirium tremens. So we use all these shortcuts so much that at one point you forget what is global confusion. So in future, if you see a patient who's exhibiting every characteristic of global confusion, you will not be able to identify that patient, right? Which means we have to not stick to what is being described in the textbook. Textbook description is not enough, right? So you should be able to identify a patient based on how you see the patient, what you see in the patient. That is what we call as clinical experience. And that matters a lot once you become a resident, once you become a consultant. And as you know, medical education is all about competencies, right? It's not just about theory, it is all about competency. And so they want to check medical students in real life scenarios. Will a student be able to pick up a particular chorioathetosis sign? Will a student be able to pick up Osler's sign? Will a person be able to find out whether it is tendon xanthomas or is it eruptive xanthomas? Because only when you can do that, you will be able to give a proper diagnosis for the patient. You will be able to manage the patient. So yes, it's appropriate to have video-based MCQs in all medical entrance examinations and medical qualification examinations, right? Okay. Yeah, it is nearly impossible to solve. Syed, I'm going to explain that to you. Can you please watch this? Yeah. So this is the reason behind why they've started including video-based MCQs in all examinations. Okay. So that is the hard truth which we have to accept and which we have to work towards. Okay. So that's the answer for the first part of the question. And this does not mean, that being said, okay, that being said, it does not mean you have to panic, right? Because I want you to understand one statement which you see in the slide. Do you see that the slide says, eyes do not see what the mind does not know? right? Eyes do not see, only what the mind does not know. So have a look at this. So have a look at this. Do you see there are two images? And one second. So as you can see here, there are two images. One image is of a senior person, a senior radiologist. Can you see that? This is a senior radiologist who's able to look at the X-ray. And on the other hand, there is a first year MBBS student who's also looking at an X-ray. Okay. And in this case, a senior radiologist will be able to pick up the pattern, right? Will be able to pick up the pattern that is necessary for diagnosing various conditions like pneumothorax, consolidation, effusion. So all these can be diagnosed within a second by the senior radiologist. Whereas if you look at the first year MBBS student, for him it is just an X-ray. It's just an X-ray film, right? The person is not able to pick up patterns. So what do you think this person lacks? Yeah, there are two things this person lacks. One is the person lacks the theoretical knowledge, right? The person lacks the theoretical knowledge for him to understand an X-ray film. Not just that, the person does not have theoretical understanding of the pattern that helps him in making a diagnosis of consolidation or effusion. That is one thing that is missing. And the second thing is the experience, right? The pattern recognition skill, right? The experience is also missing. That skill is also missing. Now compare this first MBBS student with you, right? You have prepared for the upcoming NEET PG examination. You have prepared for the upcoming FMGE examination for quite some time. Of course, you're not confident about your preparation. I know that means you're prepared well. Okay, if you're not confident, if you're saying, no, ma'am, I'm not confident, I don't think I've done it enough. So please pat yourself. Okay, pat yourself. Take it from me, you're prepared well enough. Okay, so the theoretical part of it is to some extent registered in your memory because you've finished the entire medical curriculum and now you're preparing for an examination. So the theoretical concept is there. I mean, of course, in bits and pieces, you have it in every part of your cortex. Okay, so the theoretical part, though it is questionable, you have it. And all that you will have to do is you will have to upskill yourself, right? You will have to upskill yourself to recognize a pattern the moment it is shown to you. And that does not happen miraculously on the day of examination. That comes purely by practice, right? Every skill comes purely by practice. But once you keep practicing, involuntarily, you will be able to come up with an answer. Okay, so what is the one thing that you might lack in? You might lack in this pattern recognition skill that will come by practice. Okay, so why are we discussing so much about video-based MCQ? As you all know, what happened in the latest FMG June 2026, a historic shift happened wherein they asked you 20 plus video-based MCQ, first time in the history of FMG. Okay, and these 20 plus MCQs covered principally medicine, particularly neurology. There were questions on ophthalmology, wherein they asked you about eye movements, right? Internuclear ophthalmoplegia. So they kept asking about eye movements. And there were questions on dermatology, wherein they asked you about rash evolution. Okay, and then pediatrics, wherein there was a question on floppy baby. And there was a question on radiology, surgery, OG, biochemistry, physiology. And these were the focus areas. Do you think focus areas will be different? Not much different in the upcoming NEET PG exam, if at all it is asked. So please take it from me. This does not mean there will definitely be video-based question. It is just a speculation because of two reasons. One is FMG had many video-based MCQ. Second reason, they reduced the number of MCQs from 200 to 180, right? Which means the time, the number of seconds. Now you have 70 seconds for every question, right? You have approximately 70 seconds for every question. If they are doing this, it means there is something that is happening behind the screen. So there is a high probability that there is a video-based MCQ. There are many video-based MCQ in the upcoming exam. And the focus areas are not going to be much different from what you saw on FMG. It is going to be based on gait, based on movement, right? Chorea, athetosis, eye movements, high possibility. And skin lesion evolution is a possibility. right? And if you ask me about biochemistry for inborn errors of metabolism, they can give you a video-based question. Or I hope you saw my previous video or live YouTube session where I've given you many sample video-based MCQ for biochemistry as well. So they can ask you about sample collection procedure, okay, wherein they can ask you about how long how long the tourniquet can be applied, what is the order of draw of blood sample, right? So there are so many areas wherein even in biochemistry video based questions can be asked, okay? So focus areas are not going to be much different from what you saw in FMGE. This means there is a high possibility that in the upcoming NEET PG, I won't call it as a risk. There is a possibility or a probability that there are many video-based MCQs in the upcoming NEET PG exam. But the good news, what is the good news I told you? The good news is there is no zero additional fact that you have to learn. The number of topics that need to be covered would remain the same. The number of concepts, the number of facts that need to be covered would remain the same. All that you need to do is you'll have to train your eyes, right? You'll have to train your eyes for pattern recognition so that the moment you see a video, you should think of probability and possibility of the right answer. Do you all understand this? Yeah, this is a real question. Yeah. So this is about what I would like to say. So all that you need to do is what? You will have to train your eyes. Okay. No new content, no new facts, just repetition of videos. Watch multiple videos and what do you expect here? Okay. So I would like to insist on this fact. Video-based MCQ is not new medical knowledge, right? It's not new medical knowledge. It is the same gate, right? Wide stance gate. Is it going to be different now? It is not going to be different now. But all that you will have to do is the moment you see a wide stance gate, you should be able to find out that this is wide stance gate. It is no more enough if you memorize this phrase, right? It's no more enough if you just memorize this phrase. So you should know that pattern. Floppy baby. Till now, if you know the phrase floppy baby, that is enough. But now, what are you supposed to know? You're supposed to know how to detect a floppy baby. How will you detect a floppy baby? Lift the baby by the belly, right? If you see parachute reflex, it's not a floppy baby. If all four limbs hang down, then it is a floppy baby. Floppy baby plus hypotonia, you know it is Pompey's disease. Okay. Not enough if you just know about the skin rash evolution. You should be able to pick that up from a video. Abnormal eye movements. You should be able to differentiate nystagmus from INO. Okay. So these are the differentiating features that you should be able to find out. So it is not new medical knowledge. It's all about pattern recognition that you will have to learn. Okay. Now, what are the 4 steps? You're given a video-based MCQ. Okay, you have appeared for NEET PG exam. You've appeared for FMG exam. They're giving you a video. Do not panic. What will you do? Step number 1, look at the video. Observe it as much as possible. Try to find out what is a characteristic clue that they are showing you. Yeah, maximally, what did I say? Gait, eye movements, movement of rash, evolution of rash, or if it's a sample collection, see whether they're applying the tourniquet at the right position, see if the order of draw is right, right? So the number of possibilities of videos is going to be very limited. And we all 19 educators at PrepLadder know what are the possibilities of videos that can be asked as video-based MCQs. So you will be trained, okay? So no worries about that. All that you will have to do is do not panic. Look at the video, observe the characteristic clue that is shown in the video. That is step number 1. Now link that clue to any theory that you have already learnt, right? Just does that ring a bell? Does that ring a bell? Does that tell me about global confusion? I see a person who's giving answers for every question wrongly. The person has disorientation to time. The person has disorientation to place, disorientation to person, right? The person does not understand what is happening around. So could this be global confusion? Do I see tremors? Don't I see tremors? Or if I see a hypopigmented child, right? Hypopigmented child with seizures, okay? And the history says mousy odor, right? History says mousy odor. So mousy odor, immediately should be linked to phenylketonuria. And you know, phenylketonuric children are hypopigmented. But what I see here, I see seizures as well. If I see seizures as well, it is not classical phenylketonuria, it is malignant phenylketonuria. So this pattern recognition, your brain should be trained to link all this, okay? So steps are just 4 steps. Look at the video, pick up the characteristic clue, recall any theory that strikes you, okay? Anything that rings a bell. If you don't, again, don't panic. You have another clue. Where will you see the third clue? The third clue will be there in the stem, right? The stem of the MCQ. The stem of the MCQ would give you clues like low phosphate level, normal calcium, normal vitamin D, normal parathormone. Okay, you're seeing a child who's coming with bow legs. Okay, the video shows a child walking with bow legs, and the stem says normal calcium. Listen to this: normal calcium, low phosphate, normal parathormone, normal vitamin D. Okay, you would say it is hypophosphatemic rickets. So if it's a video based question, please don't panic. You will have multiple clues at multiple levels. Watch the video, look at the stem, link all this and evaluate the right answer by looking at all the options. Okay, so if you follow these 4 steps, you will be able to answer most of the video based MCQs. Okay, of course, I know the quality of video that was asked recently was not great, but those videos were all gifs, right? So they were all like very short videos. Probably they didn't have enough time to work through it, and it was like last minute addition of video. But for NEET PG, I'm sure they would work on the quality. So I mean, always look at the brighter side of whatever is happening for which you don't have a control over. Okay, so the brighter side here is I'm going to have multiple clues. It is not just the stem. I also have a clue by looking at the video. Okay, so biochemistry, as I told you, it's not just theory, it is visual too, wherein the video can show a toddler. I told you, right? That can be a toddler who's coming with a fair skin, blonde hair, with seizures and hypotonia. So I want you to observe these seizures. Okay, the stem says, mother reports urine has a mousy odor. What did I tell you? How will you link this? Mouse and key, right? Mouse and keyboard. So mousy odor, phenylketonuria. When it is phenylketonuria, there are 2 possibilities: classical phenylketonuria and malignant phenylketonuria. Because the video shows seizures, right? Because the video shows seizures, what is your answer? It is malignant phenylketonuria. Do you all understand this? Yeah. So, and as one of you had mentioned, no point in being salty at this point in time. Okay. So whatever has happened has happened. We have learned our lessons, and let's work on whatever we have learned. Okay. And life has its own ways of throwing curve balls at us. Okay. At any stage in your life, you might think at this point, if I clear my FMG exam, I'm done with my life. I'm going to be super successful. The hard part is, the hard truth is no. Okay, at every stage in life, you will have to face challenges. So after this, it's NEET PG entrance examination. And after NEET PG, you become a resident, and then you become a consultant. And in every point in your life, there will be challenges. And the only way for you to not feel discouraged, right? And the only way for you to not get demotivated, okay, is to see the brighter side of whatever is happening around you. Okay, I learned it today. I learned that there are going to be many video based questions. I'm going to work towards it. This is for my good. How is it good for me? Because then in future, if I see a patient, I'll be able to pick it up quickly. Okay, so everything is for your good. And please don't worry about what is happening around you. And please only work on things on which you have a control. Okay, so that is about this. So if you see this, what will be a diagnosis? Your diagnosis will be malignant phenylketonuria. Okay, now look at this. This is another possibility. Before you look at the stem, please look at the video. What does the video say? Oh, the video doesn't work. Yeah, can you see? Yeah. This is a video of a child who's walking with bow legs. Okay, I've given video courtesy. I took permission. And if you look at the stem, okay, it says lab values show low serum phosphate, normal vitamin D, normal parathormone. Then what is your diagnosis? Hypophosphatemic rickets. Okay, so what is your diagnosis? It is hypophosphatemic rickets. So this is another possibility of video. So as you can see here, PrepLadder video MCQ bank. So PrepLadder, we have MCQ bank wherein we have included, it is an evolving video MCQ bank wherein all of us have started adding video based MCQs. Okay, so keep watching all those video based MCQs. And as I said, it is all about upskilling yourself. And upskilling comes purely by practice. Okay, so for all clinical subjects, we have included video based MCQs, and all preclinical and paraclinical subject faculty, we are also adding MCQs. So just work on it. Practice it multiple times, as many times as possible. You will be able to answer the question. Okay. So this is another possibility of video-based MCQ as far as biochemistry is concerned. This is all about serum versus plasma, pre-analytical error. There is a video which shows a phlebotomist collecting blood sample in a lavender top tube. And the stem of the question says the blood sample is collected for protein electrophoresis for myeloma workup. Okay, lab requests repeat sample in a red topped tube. Okay, so do you understand this? First, it was collected in a lavender top tube, but the lab said no, if it's in lavender top tube, we are not accepting the sample for protein electrophoresis. We would like a sample only in a red topped tube. Can you tell me why? What if it's a lavender top tube? Lavender top tube has got K2-EDTA. What does EDTA do? It chelates calcium. Once it chelates calcium, no clotting, right? When there is no clotting, what separates above is plasma. So the sample that gets separated in a lavender top tube is plasma. Without clotting, plasma gets separated. So plasma has fibrinogen. Okay, and when you run protein electrophoresis, the band that is present farthest from the point of application, is an albumin band. And before albumin, it's an alpha 1 band, alpha 2, beta, and the band that is closest to the point of application is gamma band. Do you understand this? Farthest from the point of application is albumin, followed by alpha 1, alpha 2, beta, and gamma band. Okay. Where do you see immunoglobulins? Immunoglobulins are gamma globulins. In case the person is suffering from multiple myeloma, in this case, the person will present with the band in the gamma region. But if I run plasma protein electrophoresis, plasma has fibrinogen. This fibrinogen also forms a band in the same gamma region. So I will not be able to find out whether it's a fibrinogen band or is it the immunoglobulin band, diagnostic of multiple myeloma. So what is the take-home message for all students who are watching this session? Serum. Serum is the preferred sample for protein electrophoresis to make a diagnosis of multiple myeloma. If you run plasma protein electrophoresis, that will create a band in the same gamma region wherein I expect immunoglobulin bands in multiple myeloma. So all of you tell me which is the preferred sample for protein electrophoresis to diagnose multiple myeloma. It's a serum sample. And to get a serum sample, I would need a red top tube. Because what is present in a red top tube? The red top tube has got silica. Right? What does silica do? Silica is a clot activator. After clot gets separated, after clot gets stabilized, what is separated above is serum. So serum does not have fibrinogen. In that case, if I see a band in the gamma region, that band is M band of multiple myeloma. Are you all clear? So tell me which is the band that is, which is the sample that is preferred for protein electrophoresis? It's a serum sample. Okay. Yeah. So these are the possible videos that you can see as far as biochemistry is concerned. And what can you expect as a support from PrepLadder? As I told you, the first support is the MCQ bank. There is no release date. If you go and check the Q bank, okay, MCQ bank, you will start seeing video-based MCQs, okay? We've started adding it already, okay? That is the first support that PrepLadder has given all of you. And the second support is, yes, NEET PG Lab 2, right? NEET PG Resolve Lab 2 live online sessions by 19 educators. The Lab 2 form is starting on December 1st, and the schedule will be released very soon. And in this Resolve Lab 2 series, all 19 educators will be including video-based MCQs. Okay, so you will be trained, your eyes will be trained, your brain will be trained for pattern recognition as you watch these live series. Okay, so these are the two supports that PrepLadder has immediately extended soon after seeing this new change, this historic change that happened in FMGE. So all subjects are covered, and all specialists, we know what kind of MCQs are probable as video-based MCQs. So you will start practicing before it counts. Okay. So to summarize, keep telling this to yourself. Eyes do not see, only what the mind does not know. Okay, so once your theoretical part is strong, right? Once your conceptual understanding is strong, your eyes will start recognizing patterns quickly. So as always, your focus should be on establishing those concepts and establishing those facts. Okay. On top of that, you're going to upskill yourself for pattern recognition by watching all these video-based MCQs. Okay. So your mind already knows the theory. Now train your eyes. That is all that needs to be done. So this is not the time for you to panic thinking about the new variant of MCQ that is being asked. It is not new medical knowledge. It is just a variant or a different type of MCQ. Okay, so join us on PrepLadder Resolve Lab 2, which starts on December 1. You will know exactly what kind of video-based MCQs that can be expected. Okay, so thanks all of you for staying with me till now. If you have any questions, you can ask me through this chat. Okay. Thanks, everybody.